pelvic floor physical therapist. Because let me tell you, this was not, I did not think this was going to be part of my little childhood dream here. When I went to physical therapy school, I was like, I'm going to open a hockey training facility, we're going to treat athletes, and I was a hockey player growing up. That was my passion, my love, still is to this day. And I still secretly want to have a hockey training facility. But I got called in to do something different, completely different. And it was the most embarrassing thing that I started peeing my pants when I was in the 6th grade. And to the love of my amazing family, my mom was always like, well, the children that pee their pants, there's something going on with them in their houses, right? And she just, she loved to curate different stories. And so I was like, oh, something must be happening to me. I'm weird. Something's wrong with my body. And I played boys hockey growing up. So every time I'd step on the ice, I would get hit and I'd pee my pants because it was physical contact sport. And it was so embarrassing. I smelled like pee. But it was just one of those things you hide. Like, you figure out how to hide it, and you do okay. And so then through high school, played softball, and the girls on my team started to joke a little bit that they peed their pants too. And I was like, oh, okay, good. So thank you. I'm so glad. I know you guys all pee yourself a little bit, because now I feel a little bit more validated for me. And then I go on to PT school, and we have this one lecture. And people aren't really taught about women's health or pelvic floor physical therapy, even to this day. It's become a long way since I started coming here and talking, and I'm so grateful that I've been here 4 or 5 times now, to be able to spread this message and awareness. But it's still, there's a long way to go as far as educating healthcare providers in what women need for pelvic floor health. And so I had this one conversation with this woman who came in, and she's talking about vaginas, and when I was in PT school, I was like, I can't even touch a knee. Like, I have to learn how to touch another human body. I was just not comfortable touching bodies. So how am I even gonna get close to this area? And so that was how it started. And she gave her talk, and she's like, if you were a child and you peed your pants, a lot of times this is very common for athletic girls. They can pee their pants, and it's often due to having a really tight and constricted pelvic floor. And I was like, oh, okay. So this is something that can be helped. And it was hard to swallow my pride and my fear of everything of my past to be like, okay, I need to learn more from you. And she took me under her wing, she mentored me, I got to learn everything from her, and it was such a gift. And I was like, once you start seeing the impact that it makes in everyone's life to treat these issues and to de-shame it, if that's a word, it was so impactful. I was like, okay, healing someone's knee after a surgery is amazing, but like unlocking this part of their body, connecting women to this part of their body, it does something different. And over the course of my career at this point, every time that I'm treating someone and they come in, there might be, you're nervous, you don't want to get help. No one wants to do this work. No one wants to get pelvic floor physical therapy. But when you do, you start to unlock something inside of yourself. And the only way I can put it is it's like a creativity. You start to feel better in your own skin. You go from being in that like survival mode, and I'll talk a little bit more about what like issues can be happening. But when you start to feel better in your body and you don't have aches and pains and your knees don't hurt and your back feels good, then you start to feel like a little bit more fulfillment. You can show up a little bit more for your kids. You're out of that survival mode and you go more into thriving. And that's where you get creative and can explore your passions. And I know that's a little bit, I'm telling you this because what I see in client after client is when they start taking care of themselves, all of a sudden, like their passions start to aliven. And they come up with these business ideas, or they come up with a new career path. And for me, when, over time I've seen now that we'll be putting ourselves into wellness and like really truly taking care of our health. When you do that, you just give so much more to your family. You give so much more to the people around you because you have decided to quote unquote be selfish. And it's not selfish at all because it is the best gift that you can give your family is taking care of your own body, your own pelvic floor. And where was I going with that? Because I was telling you my story. Oh, and so just seeing people unlock that health and wellness through pelvic floor physical therapy, this is what changes the world. Because when women thrive, our communities thrive, our families thrive, everything is so much better, and the gifts that we can bring to the world as a collective help heal the world. And so I truly believe that so much of that starts with our own internal health and really truly just taking care of our own bodies. And it's hard to do that when we don't feel good in our own bodies. So let me bring you back to my peeing my pants days. So I get my incontinence, quote unquote, fixed. I end up being told that I had a pelvic organ prolapse. So what that is that's where your bladder comes out of your body a little bit. You have a vagina, you have your bladder, and it just sags into the vagina a little bit. Yes?
Me.
Thank you. And still me. Mine is still there. And it's healing, on this journey. And I function without peeing my pants. It's still very much there, and it's something I will probably have for the rest of my life, and hopefully just can continue to avoid surgery. But so I find that out, and I'm like, okay, I didn't even have kids at this point, you guys. Like, this is pre-kids, I have this issue. And so I become a pelvic floor physical therapist, and I know I want babies. I was called to be a pelvic floor physical therapist and a mother 100%. So I was gonna do whatever it took to have my babies, and I have my first baby, and I was working, I had started a pelvic floor program at a clinic in West Seattle, and I did everything I could to for my clients to make sure that they were optimized for birth and try to help them reduce their C-section rate. And it was also boxed into the system of what healthcare is, and doing work inside the pelvis during pregnancy was very taboo at the time. I go and have my first baby, and I push for over 3 hours, have a massive 2nd-degree tear. My prolapse is so much worse, and I feel like crap because I stayed in shape during that birth. I thought I did everything possible. I was a pelvic floor physical therapist, for goodness sakes, and that's what happened. And so that didn't feel great, and I also knew something had to change, so I started to develop more of the protocols that we call our birth prep protocols, knowing that we have to change the muscles inside the pelvis to truly optimize the pelvic floor for the delivery process. Doing this does help change the C-section rate. It doesn't fix it. There's always going to be C-sections. There's things within birth that we can't control, but it can help our recovery process so much if we can do that. If anyone is pregnant, we do have an online birth prep program, and I'm happy to give that away for free to anybody who's here or anyone that's part of your group. So you can chat with us, and sorry I just put that out, but I'm sure we have a promo code for that. So then I go on to have a couple more babies. I have 3 kids. And for my third, I was like, I have to put these protocols to use. I had hired my staff by then. Everybody was trained in how to do this. And I had pelvic floor work done throughout my pregnancy. And then I show up for birth, and I'm like, this is going to go exactly how I designed it. And it did not. I still ended up, I'm very, you learn, right? Every single thing along the way is just a gift of a lesson. And my lesson was letting go of that control. There was a reason I needed to have this birth experience, and I got to now understand different parts of my patients, right? I get to experience what they go through and what they've been through. So I ended up having a birth experience. Did not tear, which was lovely, and prolapse didn't get worse, so pelvic floor felt great, but just the details of it that I had written out, God had different plans for. And for me, that then turned into just complete sadness and shame, and that was really hard. There was a lot of healing that had to go beyond that. And so part of me sharing this for you guys is just what happens during birth. We can do so much to optimize our bodies, or not. We might not know what to do for the birth experience, and maybe 10 years ago, no one even said the word pelvic floor. Now it might be more common, but we only know what we know. We show up with what we have, and we have to give ourselves grace to be like, okay, that's okay, and now let's move on and let's take care of ourselves and heal. And so after my third, I did that. I embraced the healing, had to give myself grace, and really let go of the shame. With that shame was a lot of extra weight that my body had carried as well, which was not very good for my prolapse, let me tell you. But that's what happened. So I went on a huge weight loss journey, lost over 100 pounds after I had my third, which she is now 4, and have just fully invested in my body in the way that I hope that I can inspire or help be more of what is possible, I suppose. Not in that I have it figured out kind of way, but in the way that you do what you can to put yourself first. Someone might call that selfish, but what I think it is just the more that you can thrive personally, the more that you can put into your own health, into your own body, you just show up so different, and it is such a gift to show up that way and so embodied for your family and for the community. So we're going to start being a little bit more embodied today and just get you more in touch with your pelvic floor. So who here has heard of pelvic floor? It's super trendy, I feel like, especially with social media now. Like you can, find out all the things. This is a pelvic floor. It has 3 holes: an anus, a vagina, a urethra. Pee out of the urethra, penetration, childbirth out of the vagina, and poop, farts out of the anus. Sometimes farts out of the vagina too. It's real life here. If you want to know a story, I actually filmed a video. Someone's going to be like, you can't say that at church. I filmed a video on actually having vaginal noise, because part of having a prolapse is getting air trapped in it sometimes. So if you've ever been in yoga class and you're like, oh, my vagina just farted, that's real. Like, it is real. And so how we can help manage those vaginal farts is by managing what's called our intra-abdominal pressure and how we breathe. And how we breathe can also help improve the actual function of our pelvic floor. Is everybody with me still? Am I touching things that you're like, oh yeah, okay, that makes sense? Maybe. So as far as normal pelvic floor health, I would say when you pee, you really only want to pee every 3 to 4 hours. So even if you're drinking 5 Stanleys a day or a gallon of water a day, your bladder adjusts to that volume because it's a muscle. So ideally you can hold your pee every 3 to 4 hours. If you can't, then you might have a little bit of dysfunction throughout the pelvic floor. So it might not be as healthy as it possibly could be. If you feel like you have to go pee every time you stick a key in the door, or you go pee because you know you're going to the grocery store and that automatically makes you feel like you have to go pee, then that is called urge incontinence. And so that is not a typical symptom, and it's something that you want to be able to manage and repattern so you don't get those triggers to the bladder. If you have constipation or IBS or hemorrhoids or anal fissures, those are also pelvic floor issues. Sciatica can definitely be caused by issues within the pelvic floor. People who have a history of any abdominal surgeries, hysterectomies, C-sections, thyroid removals, cysts, gallbladder removals, appendectomies, anything that comes out of the body from the abdominal canal or cavity, you can have more scar tissue through these muscles here, leading to pelvic floor issues, also leading to things like sciatica or chronic hip pain or chronic back pain. So it's really important as far as us healing our bodies, because is everybody here a parent of some? Yeah. So whether you have adopted children or your own children, it's a very physical job. But especially when they come out of our bodies, our abdominal wall is affected and our pelvic floor is affected. So our core, our deep core, isn't as strong as it could be oftentimes. And so there's a good amount of retraining that should happen in order to get you nice and strong and healthy within that deep core area. That makes sense? Also didn't even mention, but other signs of pelvic floor dysfunction that I should say here are difficulty orgasming. So if you feel like you just can't have an orgasm, or you have to work really hard for that orgasm, like you have to bruise yourself to get an orgasm, that's not typically normal, and there's usually some dysfunction within the pelvic floor. Very, very common though, by the way, and not like a scary or shameful thing, just there's a lot that you can do, and working with a physical therapist, a pelvic floor physical therapist can be extremely helpful for that. And then any difficulty with any kind of intimacy as far as penetrative intimacy, so an initial penetration or just even like deeper thrusting, this can be issues within the pelvic floor as well. So these are really, really common things that go kind of just swept under the rug. And when we sweep all this under the rug, like the deal is like we can all function. Like, you know, you might be in that phase of I am in survival mode, or you might be in like you're stepping into your thriving mode and like you are going all in on your own wellness journey. And I kind of want to challenge, I guess, if that's fair to say, everybody to start to step into that. Step into yourself, step into really taking care of yourself, because when we sweep these things under the rug, or if you're sitting there and your back is kind of hurting, or your hip is a little achy, or you know that, oh, I am peeing my pants, people don't come to us because they pee their pants, really. Most people just go their whole lives and they don't really care that they pee their pants. But the root of what is happening is the dysfunction of the pelvic floor, of this deep core muscle. And so if it's not functioning for us, then we're just wearing out our joints faster. We're creating more dysfunction within our body somewhere else, some kind of compensation, because that core isn't working. So that's why I'm saying step into your journey, step into learning about your body and really starting to heal your body, because the body's a magnificent healer. And when you do that, then things start to improve for you, and it's, yes, all those symptoms that I talked about will start to go away, but it's the long-term effects, because I don't know about you, but like I see my mom and I saw my grandma get old, and it's like, yes, my mom works out, and now after 7 years of begging her, she comes for pelvic floor physical therapy, but that took 7 years to like get her to come in, and I'm, you know, grateful that she did, but I want her to thrive, because I maybe don't want to be pushing her around in a wheelchair, right? Like I want her to be able to like keep her independence for as long as humanly possible, and then secretly, like I want that for myself. And the more that I can do that for myself, the less strain my daughters are going to carry, and my son. But that is where it's like, yes, these are symptoms, but when you treat, you start pouring into your own self and like really learning about your core and your pelvic floor and starting to work this. It doesn't mean you have six-pack abs. It just means that you're a little bit more connected to these areas. Then you utilize these areas and you start to feel better. And you start to feel stronger just by getting more connected to these areas. So, I'd love to teach you a few things today. I was going to teach some new stuff, but it sounds like I should just do a refresher. Do a refresher? Yeah. Okay, cool. All right. Well, I'll use this chair. Oh, okay. Perfect. Okay, so we'll just go over some basics. And then these basics are what you guys can teach your children as well at home. But we'll start with peeing. Really peeing. And I'm going to be a hypocrite, because I actually usually say, okay, when you go pee, you should never, ever hover, ever, because it's not great for the pelvic floor. So if you are in a porta potty, which I am in a lot these days with my kids playing soccer and all the sports, you want to hover, right? So I was at Magnuson Park on Sunday, and the toilet was full. It was full, and I had to pee, and there was stuff on the toilet, and I was like, okay, I'm hovering. And so ideally you don't hover. So really do try to sit down on the seat. And when we sit down, you want to take a couple deep breaths and breathe into your belly using a diaphragmatic breath, and then exhale and let it go. When we breathe into our belly, we relax our pelvic floor. Let's all do that together first. So you can stay in your chairs, but let's do one hand on your belly. And we'll do one hand on your chest, And I'm gonna ask you to breathe all the air into your low belly. So let your belly be soft, let it just really stick out. Inhale, bring all the air down here. Exhale, let it go. And then I want you to inhale again. And as you inhale, I want you to imagine opening your vagina as you inhale. Exhale, and you'll feel like maybe some recoil. Is it, you guys feeling it? Let me give you I keep digressing. Here's a way, if you can't feel it, this you might have to stand up for. So, and this is actually how we should all be sitting. But when you go to sit down, lift your butt cheeks up towards the sky. I'm not kidding. Yeah, let's do it. So you lift your butt cheeks up to the sky. You're gonna reach your tailbone back and then sit down. So you should be sitting on your sit bones. This chair doesn't actually fit me, so I would need to stick like a pillow back here. And I need to get a little further back. No, it doesn't. Okay, so I can stay on my sit bones. You should actually be able to relax your chest while you're sitting on your sit bones. And then this way your pelvic floor is a little bit more relaxed. So now, see if you can feel your anus or feel your vagina with your brain, just connect down there. You can give it a little squeeze if you want to, just to get the sensation. So maybe pretend like you're trying to hold back a fart right now, and then I need you to immediately let it go. Okay, and then you're gonna take a deep breath into that belly. Inhale, and you're opening everything, and then exhale and let it go. We're gonna do one more breath together. Really connect your brain to your anus. Think about flaring your anus open as you inhale. Driving all that air into the belly and into the anus. Opening, opening, opening. Exhale and let it go. You might be like, why in the world are we doing this? Well, I was going to teach you how to pee, but then I went into this first. So, but this is the kind of breath that you want to do when you sit on the toilet to go pee. Yeah?
Remind me again, inhale is bringing it together.
So inhale is opening it up. Opening the anus, opening vagina. Thinking about,
okay.
Yeah. Exhale, you'll naturally get some recoil.
Okay.
Thank you for clarifying.
Just wanted to know.
Yeah, so let me show you what's happening. So when you inhale and you fill up your lungs with the air, so you're bringing that air down into your belly and you're opening the pelvic floor, opening anus, opening vagina. As you exhale, the lungs will deflate, the diaphragm comes up, and the pelvic floor comes back up. Just naturally. You don't have to squeeze or force any of it. It just happens naturally. Most of us are so, should I say, stressed out and going about our lives, we're so tucked in, and we have really tight and elevated pelvic floors. In 95% of our clients at the clinic, we don't see people have loose, weak pelvic floors. They might feel loose and weak for you, but most of the time, within that weakness is just because they're so balled up. In this day and age and how we live, and our stress responses, the emotion that we carry in our pelvises, things are tightened and contracted. I was gonna bash one of the, if you're sticking anything up there to squeeze it, if you do any pelvic floor training that way, or you are sitting on one of those chairs causing your pelvic floor to spasm to get stronger, that's really not gonna change the muscle itself. To get true strength changes, you actually have to lengthen the muscle. So any strength comes from opening that muscle and lengthening that muscle. And so when you walk or move your body in space, every time my foot hits the ground, I'm actually getting a little contraction of my pelvic floor. And I'm not thinking about that, I'm not doing anything to do that, but my pelvic floor moves and is dynamic to move. And that's where the strength comes from. But when we're balled up and tight and we don't have a lot of connection here, then we don't have that movement, so we don't have the shock absorption. So then our joints and our back and our knees, they absorb the shocks. And then we get more of those knee aches, hip pains, and back pain. And so it's really important that we keep this dynamic movement of our diaphragm and of the pelvic floor. I usually tell people, you do not lift weights for your diaphragm, right? There's no way, like we're not lifting weights for our diaphragm. So you really don't need to be lifting weights for your pelvic floor. We have to do it different. Everybody's been taught Kegels and they don't work. All our moms still pee their pants, right? So we have to work on getting the muscle longer and working it that way. And breathing is like one of the best ways to do it. In the clinic, we do a lot of manual hands-on work of opening the pelvic floor and training the muscles to get longer. And that helps a ton because then you restructure the fibers. And then when you leave the clinic, then you do more breathing and then you have more range of motion to work with.
It's essentially like a yoga breath, right? Like the belly breath?
Yes, exactly. A diaphragm kind of breath. Yeah. And there's some, you might like see on, influencers online talk about using more like a rib type breathing or a Pilates type breath. And those are all great and fine and have their place absolutely in core training. But when we're talking about opening pelvic floor and getting as much pelvic floor dynamic movement as possible, that's where you want to go to this deep belly breathing. Does that make sense? So let's go back to peeing. You guys still with me? Okay. When you sit down and pee, I taught you how to sit on your sit-bone so you could relax your pelvic floor, but if you sit at an office or any desk, like really do that. Even when you get in your car, just adjust your butt cheeks and get on those sit-bones, because that will naturally help release the pelvic floor a little bit, and then you're not having to like sit military style to try to hold yourself up to think you're sitting in good posture. Like all you have to do is sit on your sit-bones and you can kind of relax into it. If you have a chair that fits. Again, these chairs are not, I don't really fit in it, but I'm short. So when you go to pee, you can take that nice belly breath, fill your lungs, exhale and let it go, and hopefully the pee will just start to come. If it doesn't, then you just rock back and forth. When you get the urge to pee, if it's been 3 to 4 hours, you know your bladder's probably full. If it's been under 2 hours, you might want to challenge yourself, like, hey, can I make it another 15 minutes? See if I can improve my bladder capacity just a little bit. If you're having a hard time, if you dribble on the toilet seat after you get up, a lot of times that can mean that there's some degree of pelvic organ prolapse. And the way to kind of make sure that you empty as much as humanly possible is to just shake it out. So just rock back and forth or go side to side and say, okay, did I get it all out? So if you get it all out, there's always residual pee in the bladder left over, but you just get out as much as you can, and the more you get out, the better, because then there's going to be more filling capacity and less irritation from residual pee left in the bladder. So that is what you want to do to pee. Then we're going to go to pooping. Pooping's a little different. When you get an urge to poop, let me back up. A healthy person should be pooping every day. If you poop less than every day, it might be something to start looking at, maybe getting some pelvic floor therapy. Constipation isn't diagnosed until you don't go every 4 days. That's a lot of poop in there. When we fill our colon, so our colon, our large intestine, starts down here, comes up and around, and goes across and down, and comes down here. When it's full of poop, all of that poop is sitting on the bladder, is sitting on the uterus if you still have a uterus. That is a ton of pressure. That's why I say you want to be pooping every day. So whoever made these guidelines did not think about the pelvic floor implications of not pooping every day. Because the more that we can poop, the less pressure, the less the pelvic floor has to work so hard to hold everything up and in. And we don't want the pelvic floor to have to work hard to hold everything up and in, because we need it to be as dynamic as possible. So every time our foot hits the ground, we get that natural dynamic motion of the pelvic floor. Hopefully you're going every day. If not, find a way to go every day. I have a ton of videos about pooping and managing constipation. I have videos about doing a colon massage. So you can find that stuff on our YouTube channel. Or if you have someone that you can work with, like a pelvic floor physical therapist, that'd be fantastic. Yeah?
This applies to kids too, right?
Same, yeah. So let's go into how to have a poop. When you get the urge to poop, you should go poop. Pooping isn't something you want to delay. So really try to get to the toilet within 15 minutes. When you get the urge to poop, your colon, your sigmoid colon, is expanding because it's full, and it's sending a signal to the brain, I have to poop. If you ignore that signal, then what happens is that the colon will just get bigger and get bigger and get bigger, and those signals will go away. So our body's really adaptive. So we gotta keep the signals, we gotta listen to the signals. You get the signal, you find a toilet and you go poop. When you get to the toilet, the first thing you do is you sit down so your pelvic floor can relax and open. Then a good way to sit, if this is comfortable on your body, if this is not, then it's not gonna be advantageous for you. But if leaning forward and either having a squatty potty or B, resting your elbows on your knees, this helps straighten the chute so the poop can just slide on through. Yeah, squatty potties are amazing. Yeah, just another thing in the bathroom, but great. You can also just use a trash can. Like sometimes I'll just stick my feet, I'll like bring the trash can over because not all my toilets have them.
Or the kid's step stool.
Yeah, or the kid's step stool, it's perfect. So squatty potties are great. I will tell you, if this hurts your back though, then it's not great for you. And some people find that they might need to lean backwards even. So ideally we lean forwards, but it's okay that if you need to be in a different position, because if your body is experiencing pain in any form, like in your neck, your back, your shoulder, your pelvic floor is gripping. And so it's hard to relax your pelvic floor, therefore it's hard to get that poop out. So then we're gonna have to strain to get through a tightened pelvic floor. And if we're straining to get through a tightened pelvic floor, then pop a hemorrhoid or get an anal fissure, right? Like these are just things that can happen. And so that's why we wanna poop through a relaxed pelvic floor. And so you're here, your deep breath into your belly when you get the urge to poop. 1, exhale it, so I'm doing that belly breathing. 2, exhale. On the 3rd one, if the poop hasn't just magically exited my anus, then I'm inhaling, holding the breath for a minute, making my belly big, making my belly hard, and I'll gently bear down like I'm trying to pass gas, but I don't want anybody to see me pass gas. So on that 3rd inhale, it's belly big, belly hard, and that's how I teach my kids too. That's been the best cue for me is, okay, take a couple breaths, and then now I want you to do belly big, belly hard, and that just helps them increase that pressure, and then the poop will come out. So play with that, yes.
You have no problem going every day, but when you travel, you don't go. Is that a pelvic floor issue, or is that like psychosis, or is that dietary?
I mean, it could be dietary, it could be that if you get bloating during travel, it's not necessarily a pelvic floor issue. I would just say find out, is it hydration? And is it hydration, is it stress related? Is it, and then what can you do for that? Do you need to take magnesium or travel with some extra fiber? Just something that can be supportive of getting you a bowel movement. But last month I was in Orlando twice, and the first trip I couldn't get a bowel movement, and I did everything I could, and it's like, it sucks, right? Like you want to. The quality of my life is determined by the quality of my poops. But truly, I don't feel good when I have a lot of poop in me, but I also have prolapse, so that doesn't make anything feel good. It makes me feel heavy and achy when I have, constipation. So, yeah, good question. Other questions? I wanted to teach one other thing that I haven't taught here. Actually, 2 other things. Do we still have time, guys? Okay. So one way to improve your pelvic floor health is just simply through posture. So a lot of times when we're out and about, when we're walking, or we're holding our babies, we can kind of stand in like these kind of postures, or we can throw a kid on a hip, and that might, but what is most advantageous for your pelvic floor and pelvic floor health is to take your rib cage. Why don't you guys all stand up and do this with me so you just have some sense. Having your rib cage sit right on your pelvis or even slightly forward will help you give a little tension to the bladder and help bring the bladder up. And it helps keep a little bit of pressure off the pelvic floor and off of the back. Don't do this if it hurts, please, please. So a lot of times, like if our rib cage is here, we want to take our rib cage and then you're just bringing it on top of the pelvis, and it's just a little bit forward. So instead of being like here, I could pull a string from my head and lift me up to the ceiling, but if I didn't bring my rib cage a little bit forward, then I'm not using my core as much, and there's a little bit more pressure on the pelvic organs. So in order to have like really good pelvic floor health, our posture matters. And that will be supportive of your back and your hips. So I thought it would be an easier cue, but I don't know, does that seem like it's resonating where your rib cage is sitting? Maybe? Play with it. Just know that if your rib cage is sitting back here, that's a ton of pressure in your low back, and that's a ton of pressure down on your pelvic organs. So to keep your pelvic floor safe and healthy and keep those organs in the places that we want them, getting that rib cage sitting on top of your pelvis. When you're walking up a hill, keeping that motion of like, I'm leading with my chest. Yes?
Is this the drop your boobs situation?
Sorry, drop your boobs.
That's what one of your therapists said.
Okay.
Drop your boobs.
Yeah, that might have been specific to you.
Instead of.
Yes.
It's okay, not a little forward and down.
Totally, yes, yeah. Yeah, because you don't want to like crank. Yeah, if you're cranking here, yeah. I haven't taught this before, and I was like, maybe this will be general, but everyone is so specific. If it doesn't feel right in your body, like listen to what you've been told, because that's definitely right for your body. Does that make sense? So, okay, I thought that one would maybe be a little easier to implement, but no, that's okay. Well, thank you so much for, yeah, go ahead. For potty training?
It's like kids are so tense when I'm in the toilet.
You have a 3-year-old? Oh, 2-year-old? Yeah. As whatever you can do to take away that intensity. So even if it's like, I don't want to make you cringe, but like, is it a girl or boy? Okay, yeah, so like even being like, you can go potty outside, like is that comfortable for your kiddo? You know, and because then it's like their system is naturally relaxed, whether they're squatting or whether they're standing. By the time that we get to be adults, our pelvic floor typically doesn't know how to relax in a squatted position. And so we tend to be more tense. So but you can train yourself to relax your pelvic floor in this position too. And you can poop on a hike safely in a squatted position. But typically we have like more tension, but children can go in that position. So whatever like takes the stress off for your kiddo would be my answer. Yeah.
I'm a postpartum nurse,
Awesome.
and I have a lot of situations where after the mom has a vaginal birth, within like a little while of time, we're hoping that she could pee twice, if that's what we're looking for. And after a mom has a C-section, we take out the catheter, we're hoping within 4 hours she has to pee. And sometimes if they just can't pass the urine, sometimes we'll have them like blow into a water bottle, into a straw, and just blow bubbles. So is that kind of engaging that breathing pelvic floor? I just always thought it was, you're focusing on blowing bubbles, and it helps you relax and distract you from the urge you're trying to force.
Yeah.
Is that connected like that?
Totally. Some people can get that relaxation with blowing. It's person specific. So a lot of times when we teach core engagement and we teach like activating your lower abdominal muscles and deep core muscles, we teach it by actually making an SH sound. Do this with me, see if you feel it. Put your hands here and shh. Do you feel affirming under your fingers here? Shh. So that is where you're getting more like core activation instead of relaxation. But I don't want to say that that's not appropriate at that time because you're trying to get the pee. Like you are trying to initiate the bladder to have, to contract. So sometimes it's like, should I breathe my baby out or should I push my baby out? Honestly, it's like kind of the same conversation because when you contract, you're just putting more pressure on that bladder to evacuate. So ideally, no. Ideally, in an everyday situation, we want to be opening and relaxing. But if you are having to increase intra-abdominal pressure at all to get the bladder to release urine in a situation like that, to make sure that they still can. Because it's tricky after a catheter.
Yeah, and I know that's a unique experience of the first time you pee after you've had a vaginal birth, or trying to help your body get past that, anesthesia effect of the bladder function, because I know it's kind of different, but I just know
Yeah.
what it does.
Yeah, yeah. I would say I would love to like just say, oh, try shaking back and forth and see if they could initiate some pee that way. And if they didn't have a C-section, they can always put their hand underneath the bladder, and you can do this at like birth or no birth, and just that's how you're rocking forward. Like you're kind of like lifting it up as you're sitting and rocking forward, so you're supporting it. If you're like sitting on the toilet and you're like, I really gotta poop, I got a little bit of an urge, or at least I just want to poop, another thing you can do is you can take your hands, pretend I'm in a good pooping position, you take your hands and you just scoop up your colon on the side, and what? On the left, and you can pull like up towards your head a little bit, just give a little pressure, and that can be really nice way to stimulate a bowel movement. You can do the whole colon massage and be on the inside of your hip on this side and work your way around. But sometimes we don't have time for that. We're like, I just want to help it come out, and you just stick your fingers there, and you can kind of bend over it, you know, as you're in that position. Yes.
So what's the turnaround time of you, I know it's probably super vague, but like actively doing certain things before you see results of like not leaking or better pooping?
What's the
Like,
turnaround?
how long would you need to like do certain things, exercising, work on your breathing, work on your sitting, doing your little poop shimmy before you're like, oh, things are actually better?
Yeah. I would say that this is really I'm giving these tips as like a maintenance, like how to optimize your health, but if you're having any issues, definitely like I would get help if you have the means. If not, like digest our YouTube channel. Like there is so much there that you can start helping yourself. The true magic comes when you heal your scar tissue, so any scar tissue that you have in your belly or your pelvic floor, you improve the length of your pelvic floor. That's where the magic happens. Because if you can improve that, then your hips move better in their sockets. Then you can get your butt to fire really, really good. And then you can start to really be a shock absorbing machine so that you protect your back, you protect your hips, you protect your knees. Now we all do our best and we'll still have a story. Like it's not like then you're just cured, right? Like we have to keep going and we have to, you know, live our lives, and you know, you do everything you possibly can, I would say, to optimize yourself, and you still might have a fall where you have to then start over. And it's like recovery is also wellness, which then when you're done with the recovery, it turns back into wellness. And you know, you just keep going back through the cycle, if that makes sense. Yeah.
Going back to the pee position.
Yes.
I've heard that, like, 'cause I feel like you can't lift your toes off, or like your heels off the ground. Is that true when you're going to pee?
So typically you get more contraction of the pelvic floor if you're holding contraction in your calves. So that's why we say typically, if it's okay with your body, go feet flat and see if you can relax more feet flat into the ground. Because when we're here, you might feel like we're a little bit more contracted. Like you just naturally, you're activating your glutes a little bit every time you're pushing through your toes. And then when that's happening, there's going to be a little bit of contraction through pelvic floor. So you kind of want to be here and just melt. Relax your jaw. Jaw is connected to pelvic floor. So keeping your jaw relaxed and doing some breathing this way can help. So, we also, I know some people are very averse to pelvic floor physical therapy, and we have some really cool cutting edge like regenerative tools that we use in our clinic now for people that don't want the invasiveness of pelvic floor physical therapy. It's not necessarily changing the texture of the pelvic floor or getting to the root causes, but it can be massive, massive, massive in how it dissolves scar tissue and how it improves muscle function. So we have like a giveaway, so you guys can all come to the clinic and try it. It's called, we have Shockwave and EMTT, where we do these technologies to help stimulate cell healing on a cellular level. And so they're pretty cool, and they're like, I'm kind of addicted. Again, like my story like has just evolved the clinic. I brought Shockwave in for me personally, and also for C-section scars, because I was like seeing people and I fixed their C-section scar and like have it totally functional, and then they'd have really good core activation. But then like I'd see them in 6 months and I'm like, why is your scar re-adhered? Like now you can't use your core as much. So that's why I bought Shockwave and we've been using it with these incredible results to dissolve the C-section scars and really get them mobile so you can activate your core. And this is my tidbit, sorry. Really, it's so exciting because what we have found through this innovation, it's all honestly off-label from the FDA, and so what I'm trying to push forward right now, and I'm speaking on in a lot of different conferences, is moving this technology forward to help all these women's health issues that we've now documented are incredible changes just from using this abdominally, from core activation to endometriosis management to removing cysts, pre and post imaging after Shockwave, cysts are gone, and it's really amazing, and it's non-invasive and it doesn't hurt, and so it's pretty cool stuff. Anyways, thanks for listening, but you guys all get a free trial of it, so please feel free to reach out to our office.